HIV or AIDS disease for our biology presentation. First, let's meet my members. I'm Nabila.
I'm Nurin. I'm Nuha.
I'm Aini.
I'm Sheldon.
And now, let's get right to the video. Oh, Nurin, I found this disease that we can present for our biology presentation. It's called AIDS. And I also found the chronology for this disease, where in 1981, AIDS or acquired immunodeficiency syndrome was first recognized in the United States with the identification of unusual illnesses in a group of gay men. And a year later, the CDC or Centers for Disease Control and Prevention labeled the condition acquired immunodeficiency syndrome or AIDS. And then 2 years later, the researchers had identified the cause of the disease, which is a virus that they named as human immunodeficiency virus HIV. And then a year later, a test for HIV was finally developed so that the detection of the virus can be detected even before the symptoms appeared. But this disease went on for years without any treatment, to the point that people even thought that this disease wouldn't have any treatment developed. But until the early 2000s, around 1990s, the development of effective antiretroviral therapy, ART, finally allowed people living with HIV to have a normal life expectancy, particularly when the diagnosis is made early and they also wouldn't pass the infection on. Isn't this very interesting? I think we should do the presentation on this disease. Nurin, are you listening to me? Are you okay? You look sick. And as for Malaysia, by the end of 2020, the number of cases has decreased by 50%, and 97% of individuals already got ART treatment and the virus are no longer active. I think this topic is very interesting, we should do it. Oh, and for the recent cases, I found it on TikTok recently. There's this HIV positive male patient that went to the Bazaar Ramadan and harassed the female customer there. He went around touching them and harassing them. I don't even know why he did all that. Are you okay, Nurin? I don't think you look okay. You look sick. We should go to the clinic. I want to bring you to the clinic. Let's go.
So you must be Nurin?
Yes, that'll be me.
Nurin, what was you doing today?
I've been feeling off lately. Started just feeling tired after a day, but then I started having night sweats and my muscles feel sore all over.
Well, have you had any fevers, chills, or swollen lymph nodes before?
Recently, yeah, I had a mild fever, but then it went away. And I think like I felt my lymph nodes swollen, especially around my neck, and I think like I also have some joint pain.
I see. Do you have any skin rashes, mouth sores, or unusual weight loss?
I don't think so, but I think I've been feeling off about my appetite that caused me to lose some weight.
Alright, so based on what you're describing, fatigue, swollen lymph nodes, and night sweats can be caused by several different things, so we need to done a blood test. Do you have any recent illnesses or infections?
I don't think so, but I did have a blood transfusion done recently.
Okay. I'll get the nurse to get your blood sample. So in the meantime, Raceval and drink plenty of fluids. We'll come back to you later, okay?
Okay.
Alright, thank you for waiting. I do have your test results right now, and I'm very sorry to inform you that you have been tested positive for HIV.
Wait, what? Are you sure? Can you run the test again or do something else to confirm it again?
We already ran some confirmatory tests and the results are conclusive. I know this is a lot to take in, but you are not alone in this.
What? I mean, like, what could have led to this? I don't think I've been doing something that could actually have get me this illness.
Well, HIV have main three causes. The first one being through sexual contact without any sort of protection. Individuals with multiple partners have the higher tendency to get HIV infected. And the second one is through sharing contaminated needles, syringes, or any injecting materials. The most common cases here in Malaysia to get HIV is through blood transfusions. The third one being the mother who has HIV and her child. HIV can be transmitted through labor, breastfeeding, or even pregnancy. I'm assuming your case will be the second one.
So you're telling me that just recently I have done a blood transfusion can cause me the illness that I have now?
Yes, unfortunately.
So what do I need to do to get better?
I'm referring you to a HIV specialist. He'll be able to explain everything from the treatment and any questions that you have. I'll give you his address and you can go.
Alright, doctor.
Hi, I'm Dr. Shazwan, an infectious disease specialist, and this is my assistant, Dr. Noha. So, as I heard, Dr. Aini referred you guys to us to talk about your treatments.
Yes.
Yeah, so I know it might be overwhelming hearing that you have HIV, but don't worry, with the right treatment, HIV will be manageable and you'll live a long, healthy life.
So can you tell me more about what should I do now?
So, we'll start you on antiretroviral therapy, just one pill a day, and this should stop the virus from multiplying and protect your immune system.
One pill a day, that's it?
Yes, in most cases, modern ART is only one pill. It combines multiple medication so that it's simple for the patient to take.
Oh, may I know if there are any side effects that I shouldn't know of?
Yeah, so in some cases, some people may experience mild nausea and headaches, but usually these will go away. If you do have any problems, you should tell us and we'll adjust the medication for you.
So do I have to take this medication for life?
Just like any long-term condition. But with ART, you can have a normal lifestyle, you can work, you can have relationships, and you can plan for the future. But you don't have to worry, my team and I will be here with you every step of the way.
Alright, let's do this.
Okay?
So can you explain more about the precautions that I need to take care of? I mean, like, what's the important big steps I need to do?
So for that, I'll pass it on to Dr. Nuha for her to explain to you guys.
The most important step is you need to take your antiretroviral therapy regularly. This medication can help to control the virus, keeps your immune system strong, and reduce the risk of transmitting HIV to others. For your lifestyle, you should eat a balanced diet, exercise regularly, and avoid smoking. Also, make sure to get vaccinated against infections like hepatitis B, pneumonia, and flu.
I see. So can you tell me more about my daily interactions with others? Do I need to limit it or?
HIV do not spread through casual contact like hugging, sharing food, or using the same toilet. However, you must avoid sharing needles, razors, or anything that may have blood on it. If you have cuts or wounds, cover them properly.
That makes sense. Then do I need to tell everybody about my condition?
You don't have to disclose your status to everyone, but it's important to inform your healthcare providers so that they can give you the best treatment. If you have a partner, it's good to have an open discussion with them to ensure the safety too.
Well, I came with Nurin as a companion, but I want to ask if I have any precaution that I need to do so that I won't get infected as well.
That's a great question. If you're not living with HIV, you still can take the preventive steps, which is avoiding sharing needles, razors, or anything that may have or personal items that may have blood on it.
So being around Nurin wouldn't put me at risk?
Correct. There's no need to avoid any daily activities together. In fact, your support is most crucial during this time.
Thank you, doctor, for your guidance. I feel like I'm more in control now.
I'm glad to hear that. Remember, HIV is manageable, and with proper care, you can live a fulfilling life. If you have concerns or feel unwell, feel free to reach out. Let's work together to keep both of you informed and healthy.